Question 1. The performance metrics show that a particular prescription diet, while meeting OFCO standards for its intended life stage and species, has been anecdotally reported by some clients to improve signs of joint discomfort in senior dogs. A veterinarian is discussing this diet with a client whose senior dog is experiencing mild joint stiffness. The veterinarian is aware of the anecdotal reports, but also knows the diet does not have an official OFCO claim or FDA approval for managing joint health. What is the most appropriate way for the veterinarian to discuss this diet with the client, adhering strictly to U.S. regulatory frameworks for pet food labeling and claims? Option A. Recommend the diet, stating it is scientifically proven to help with joint discomfort in senior dogs, as many clients have reported positive outcomes. Option B. Recommend the diet, explaining that it meets all nutritional requirements for senior dogs and that some owners have observed improvements in their pet's mobility, while clarifying that these are anecdotal observations and not official therapeutic claims. Option C. Recommend the diet for its nutritional benefits and subtly imply that it is a good choice for dogs with joint issues, as it is a special formula that many find helpful. Option D. Recommend the diet, stating it is the best option for managing joint discomfort in senior dogs due to its unique ingredients, even though it lacks official therapeutic claims. Correct answer is A. Recommend the diet, stating it is scientifically proven to help with joint discomfort in senior dogs, as many clients have reported positive outcomes. Explanation. This scenario presents a professional challenge due to the conflict between a veterinarian's desire to provide a seemingly beneficial recommendation and the strict regulatory requirements governing pet food labeling and claims. The veterinarian is aware of a product that, while not officially recognized for a specific therapeutic benefit by regulatory bodies, has anecdotal evidence of positive effects in certain patient populations. The challenge lies in balancing client-perceived needs and anecdotal evidence with the legal and ethical obligations to ensure accurate and substantiated claims. The correct approach represents best professional practice because it prioritizes adherence to regulatory frameworks, specifically the Association of American Feed Control Officials, OFCO, guidelines and relevant FDA regulations for pet food labeling in the United States. This approach ensures that any claims made about a pet food are truthful, not misleading, and supported by scientific evidence or recognized standards. By recommending the product based on its established nutritional adequacy for its intended life stage and species, and by clearly communicating the limitations of any anecdotal observations without making unsubstantiated therapeutic claims, the veterinarian upholds professional integrity and protects the client from potentially misleading information. This aligns with the ethical duty to provide accurate information and avoid misrepresentation. An incorrect approach that involves directly recommending the product for a specific therapeutic benefit, such as improving joint health, without the product having an official OFCO claim or FDA approval for such a use, constitutes a regulatory failure. This is because it violates the principle that therapeutic claims must be substantiated and approved. Such a claim would be considered misleading to the consumer, as it implies a proven efficacy that has not been validated through the appropriate regulatory channels. Ethically, this is a failure to be truthful and transparent with the client, potentially leading to misplaced expectations and reliance on a product for a condition it is not officially recognized to treat. Another incorrect approach, which is to state that the product is scientifically proven to help with a specific condition without providing specific, verifiable scientific evidence or regulatory approval for that claim, is also a regulatory and ethical failure. The term scientifically proven carries significant weight and implies a level of validation that must be demonstrable. Without such substantiation, this statement is misleading and unsubstantiated. Ethically, it misrepresents the product's capabilities and could lead the client to make purchasing decisions based on false pretenses. Finally, an incorrect approach that involves implying a therapeutic benefit through subtle language or by associating the product with a condition without making a direct claim, such as many owners find this food helps their pets with mobility issues, is still problematic. While not a direct, overt claim, it can still be interpreted as an endorsement of a therapeutic benefit without proper substantiation. This skirts the edges of regulatory compliance and can be considered ethically questionable, as it attempts to leverage anecdotal evidence to suggest efficacy without meeting the burden of proof required for such claims. The professional decision-making process for similar situations should involve a thorough understanding of the applicable regulatory framework, e.g., OFCO, FDA for the U.S. When faced with anecdotal evidence or a desire to recommend a product for a specific benefit, the professional must ask, is there an official OFCO claim or FDA approval for this specific therapeutic benefit? If not, the recommendation must be limited to the product's general nutritional adequacy for its intended species and life stage. Any discussion of anecdotal benefits should be framed as such, clearly stating that these are not scientifically proven or officially recognized claims and should not be relied upon as a primary treatment. Transparency and honesty about the limitations of the product's claims are paramount. Question 2. Which approach would be most appropriate for a certified veterinary technician specialist, VTS, nutrition when assessing a canine patient presenting with chronic intermittent vomiting and diarrhea to determine the optimal dietary management strategy? Option A. Immediately implement a novel protein elimination diet based on common canine allergens without further diagnostic investigation to quickly identify potential food sensitivities. Option B. Rely on anecdotal evidence from online forums and client testimonials regarding successful dietary changes for similar cases to guide the nutritional plan. Option C. Initiate a high-fiber diet to firm up stools, assuming the primary issue is a lack of dietary bulk, and monitor for any changes in vomiting. Option D. Conduct a comprehensive risk assessment by evaluating the patient's complete medical history, current clinical signs, diagnostic results, and potential gastrointestinal stressors to predict the likelihood and severity of adverse outcomes associated with different dietary interventions. The correct answer is D. Conduct a comprehensive risk assessment by evaluating the patient's complete medical history, current clinical signs, diagnostic results, and potential gastrointestinal stressors to predict the likelihood and severity of adverse outcomes associated with different dietary interventions. Explanation: this scenario is professionally challenging because it requires the veterinary technician specialist in nutrition to balance immediate patient needs with long-term digestive health, all while adhering to established nutritional guidelines and veterinary recommendations. The risk assessment approach is crucial for systematically evaluating potential outcomes of different dietary interventions. The correct approach represents best professional practice because it prioritizes a structured, evidence-based method for evaluating a patient's digestive status and potential nutritional interventions. This aligns with the VTS nutrition's role in providing expert, science-driven nutritional support. By considering the patient's history, clinical signs, and diagnostic findings, a comprehensive risk assessment allows for the identification of potential complications and the selection of the most appropriate, least invasive, and safest dietary strategy. This proactive evaluation minimizes the likelihood of adverse events and optimizes therapeutic outcomes, fulfilling the ethical obligation to provide competent and compassionate care. An incorrect approach that focuses solely on empirical trial and error without a systematic risk assessment fails to meet professional standards. This could lead to delayed diagnosis of underlying issues or exacerbation of existing conditions, potentially violating the principle of do no harm. Relying on anecdotal evidence or unverified information, rather than established physiological principles and diagnostic data, constitutes a failure to adhere to evidence-based practice, a cornerstone of veterinary medicine and specialized practice. Another incorrect approach that involves implementing a highly restrictive diet without a thorough assessment of the patient's specific digestive capabilities and potential nutrient deficiencies overlooks the complexity of digestive physiology. This could result in iatrogenic malnutrition or imbalances, directly contravening the VTS nutrition's responsibility to ensure appropriate and balanced nutritional support. Professional decision-making in such situations should involve a systematic process. 1. Thoroughly gather patient history and perform a complete physical and nutritional assessment. 2. Identify and prioritize potential gastrointestinal issues based on clinical signs and diagnostic data. 3. Conduct a risk assessment for each potential dietary intervention, considering efficacy, safety, and potential side effects. 4. Develop a phased nutritional plan, starting with the least complex and highest probability of success, while monitoring closely for response and adverse events. 5. Continuously reevaluate and adjust the plan based on patient progress and new information. Question 3. The review process indicates a canine patient presenting with persistent vomiting and anorexia for 72 hours, with no significant findings on initial abdominal radiographs. The attending veterinarian is considering initiating parenteral nutrition. Which of the following represents the most appropriate initial approach for the veterinary technician specialist in nutrition? Option A. Recommend a complete gastrointestinal assessment, including blood work to evaluate metabolic status and GI function, before formulating a parenteral nutrition plan. Option B. Initiate a high-fat parenteral nutrition emulsion via a peripheral catheter to address the caloric deficit. Option C. Administer a hypertonic dextrose solution to provide immediate caloric support while awaiting further diagnostics. Option D. Prepare a standard intravenous fluid bag with added electrolytes and a basic amino acid solution for immediate administration. The correct answer is D. Prepare a standard intravenous fluid bag with added electrolytes and a basic amino acid solution for immediate administration. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist in nutrition to critically evaluate a complex patient case and determine the most appropriate route for nutritional support, balancing immediate patient needs with long-term outcomes and adherence to established veterinary nutritional guidelines. The challenge lies in discerning subtle clinical indicators and understanding the nuances of parenteral nutrition, PN, indications and techniques beyond basic fluid therapy. Correct approach analysis. The correct approach involves a thorough assessment of the patient's gastrointestinal, GI, tract function, and the overall metabolic status to determine if PN is truly indicated. This aligns with best professional practice by prioritizing patient safety and efficacy. The decision to initiate PN should be based on the inability of the GI tract to meet nutritional requirements, as evidenced by persistent vomiting, diarrhea, malabsorption, or obstruction, and a projected period of inadequate oral intake. The technique should then focus on selecting appropriate formulations, considering osmolarity, electrolyte balance, and caloric density, and implementing strict aseptic techniques for catheter care and administration to prevent complications like infection and hyperglycemia. This approach is ethically sound, prioritizing patient well-being and adhering to the principles of responsible veterinary care as outlined by professional veterinary organizations and regulatory bodies governing veterinary practice. Incorrect approaches analysis. Initiating PN solely based on anorexia without a comprehensive GI assessment fails to adhere to established guidelines for nutritional support. This approach risks unnecessary intervention, potential complications associated with PN, and may delay addressing the underlying cause of anorexia. Ethically, it represents a failure to provide appropriate and evidence-based care. Administering PN without considering the patient's electrolyte and metabolic status before and during therapy is a significant regulatory and ethical failure. PN formulations are complex and require careful balancing of nutrients to avoid iatrogenic imbalances, such as hyperkalemia or hyperglycemia, which can be life-threatening. This oversight demonstrates a lack of due diligence and a disregard for patient safety. Using a standard fluid catheter for PN administration without proper sterile technique and without considering the osmolarity of the PN solution is a critical error. PN solutions are often hyperosmolar and require specific catheter types and meticulous aseptic protocols to prevent phlebitis, thrombosis, and systemic infection. This approach violates fundamental principles of safe drug and nutrient administration and could lead to severe patient harm. Professional reasoning. Professionals should approach such cases by first performing a comprehensive diagnostic workup to identify the root cause of the patient's condition. This should include a thorough physical examination, history, and appropriate diagnostic tests, e.g., blood work, imaging. Based on these findings, the veterinary team should collaboratively determine if the patient's GI tract is functional and capable of meeting nutritional needs. If not, the decision to initiate PN should be a deliberate one, guided by evidence-based protocols and a clear understanding of the risks and benefits. Continuous monitoring of the patient's response to PN, including metabolic parameters and signs of complications, is paramount. This systematic approach ensures that the chosen nutritional strategy is both appropriate and safe for the individual patient. Question 4. The analysis reveals a canine patient presenting with chronic kidney disease and concurrent inflammatory bowel disease. The attending veterinarian has requested a nutritional assessment to guide dietary management. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for a certified veterinary technician specialist, VTS, nutrition in this scenario? Option A. Reviewing the patient's complete medical history, physical examination findings, recent diagnostic laboratory results, including renal values, electrolytes, and albumin, and the current diet, then formulating a detailed report of findings and potential nutritional concerns for the veterinarian's review and approval. Option B. Independently selecting and prescribing a specific prescription diet and feeding protocol, and initiating the diet change without direct veterinary confirmation. Option C. Recommending a standard therapeutic diet for chronic kidney disease based on general guidelines, assuming it will also be appropriate for the inflammatory bowel disease. Option D. Focusing solely on the patient's body weight and body condition score to determine caloric needs, without further investigation into other physiological parameters. The correct answer is A. Reviewing the patient's complete medical history, physical examination findings, recent diagnostic laboratory results, including renal values, electrolytes, and albumin, and the current diet, then formulating a detailed report of findings and potential nutritional concerns for the veterinarian's review and approval. Explanation. The analysis reveals a scenario where a certified veterinary technician specialist, VTS, in nutrition is tasked with performing a nutritional assessment on a patient with a complex, multisystemic disease. This situation is professionally challenging due to the inherent variability in patient response to nutritional interventions, the need to integrate information from multiple diagnostic sources, and the ethical imperative to provide evidence-based, individualized care within the scope of practice. Careful judgment is required to ensure the assessment is thorough, accurate, and directly informs a safe and effective nutritional plan. The correct approach represents best professional practice because it prioritizes a comprehensive, systematic evaluation of the patient's current nutritional status, metabolic state, and disease progression. This aligns with the VTS nutrition's role in gathering and interpreting data to support the veterinarian's diagnosis and treatment plan. Specifically, it involves a detailed review of the patient's history, physical examination findings, diagnostic results, including laboratory values and imaging, and a thorough evaluation of the patient's current diet and feeding method. This holistic approach ensures that all relevant factors influencing nutritional needs and potential complications are considered, leading to a more precise and effective nutritional recommendation. This adheres to the ethical principles of beneficence and non-maleficence by aiming to optimize patient outcomes and minimize harm. An incorrect approach that focuses solely on body weight and body condition score without considering other critical factors would be professionally unacceptable. This failure stems from a lack of comprehensive data gathering, potentially leading to an incomplete or misleading assessment. Ethically, this could violate the principle of non-maleficence if it results in an inappropriate nutritional recommendation that exacerbates the patient's condition. Regulatory frameworks for veterinary technicians emphasize the importance of accurate data collection and interpretation to support veterinary medical decisions. Another incorrect approach that relies on generalized nutritional guidelines for the specific disease without individualizing the assessment would also be professionally unacceptable. This demonstrates a failure to recognize the unique needs of each patient and can lead to suboptimal outcomes. Ethically, this approach neglects the principle of individualized care, which is fundamental to responsible veterinary practice. It also fails to meet the professional standard of practice for a VTS nutrition, which requires a deeper level of expertise in tailoring nutritional plans. A third incorrect approach that involves making definitive diagnoses or prescribing specific therapeutic diets without direct veterinary authorization would be a significant regulatory and ethical failure. This oversteps the established scope of practice for veterinary technicians, which is to assist and support the veterinarian, not to independently diagnose or prescribe. Such actions could lead to patient harm and expose the technician and practice to legal repercussions. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review all available patient information, including history, physical exam, and diagnostics. Second, Identify key nutritional concerns and potential risks based on the patient's disease state and current condition. Third, consult relevant, evidence-based literature and guidelines, but always critically evaluate their applicability to the individual patient. Fourth, collaborate closely with the attending veterinarian, presenting findings and proposed nutritional strategies for their review and approval. Finally, document all assessments, recommendations, and communications meticulously. Question 5. Risk assessment procedures indicate that a canine patient diagnosed with chronic enteropathy presents with intermittent vomiting and diarrhea. The attending veterinarian is considering two distinct dietary interventions, a novel protein diet and a highly digestible, low-fat diet. Which of the following approaches best aligns with the principles of veterinary nutrition fundamentals for managing this condition? Option A, suggesting the highly digestible, low-fat diet solely because it is a widely available sensitive stomach formula that has shown general success in other gastrointestinal cases. Option B, advising the novel protein diet based on anecdotal reports from other veterinary professionals without verifying the specific scientific evidence for its efficacy in chronic enteropathy. Option C, recommending the novel protein diet due to its potential to address food sensitivities, which are a common contributing factor to chronic enteropathy, and its formulation designed for improved gastrointestinal tolerance. Option D, recommending the highly digestible, low-fat diet because it is generally perceived as a healthier option for dogs with digestive upset, irrespective of the specific pathophysiology of chronic enteropathy. The correct answer is C, recommending the novel protein diet due to its potential to address food sensitivities, which are a common contributing factor to chronic enteropathy, and its formulation designed for improved gastrointestinal tolerance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist in nutrition to differentiate between two common but distinct dietary approaches for managing a specific gastrointestinal condition in a canine patient. Misinterpreting the nuances of these diets could lead to suboptimal patient outcomes, exacerbation of clinical signs, or even adverse effects. The challenge lies in applying fundamental nutritional principles to a clinical context, considering the patient's specific needs and the scientific basis of each dietary intervention, all within the scope of practice and regulatory guidelines for veterinary technicians. Correct approach analysis. The correct approach involves a thorough understanding of the pathophysiology of the canine gastrointestinal condition and the specific mechanisms by which each dietary strategy aims to mitigate it. This requires evaluating the macronutrient and micronutrient profiles, the source and digestibility of ingredients, and the intended physiological effects of each diet. Best professional practice dictates selecting the diet that is most scientifically supported for the condition, considering factors like palatability, owner compliance, and potential for adverse reactions, all while operating within the established scope of practice for a VTS nutrition. This aligns with the ethical obligation to provide evidence-based care and to act in the best interest of the animal patient, adhering to the principles of veterinary medicine as guided by relevant professional bodies and regulatory frameworks. Incorrect approaches analysis. One incorrect approach would be to recommend a diet based solely on its marketing claims or anecdotal evidence, without critically evaluating the scientific literature supporting its efficacy for the specific condition. This fails to uphold the standard of evidence-based practice, potentially leading to patient harm and violating ethical guidelines that mandate the use of scientifically validated treatments. It also oversteps the professional boundaries by making a recommendation without sufficient justification. Another incorrect approach would be to choose a diet based on its perceived palatability alone, without considering its nutritional adequacy or suitability for the underlying medical condition. While palatability is important for compliance, it should not supersede the primary goal of therapeutic nutrition. This approach neglects the fundamental principles of veterinary nutrition and the specific requirements of the patient's health status, potentially leading to nutritional deficiencies or exacerbation of the condition. A third incorrect approach would be to recommend a diet that is generally considered healthy, but lacks specific therapeutic properties for the diagnosed gastrointestinal issue. This demonstrates a lack of understanding of the specialized nature of therapeutic diets and the importance of tailoring nutritional interventions to specific medical conditions. It fails to meet the professional standard of care expected of a VTS nutrition, which involves applying specialized knowledge to address complex health problems. Professional reasoning. Professionals should approach such decisions by first conducting a comprehensive assessment of the patient's condition, including a thorough review of diagnostic findings and clinical signs. This should be followed by an in-depth research of evidence-based nutritional strategies for the specific condition, critically evaluating the scientific literature. The VTS nutrition should then compare the available therapeutic diets, considering their composition, mechanism of action, potential benefits, and risks. Consultation with the attending veterinarian is crucial to ensure the chosen diet aligns with the overall treatment plan and owner capabilities. This systematic, evidence-based, and collaborative approach ensures the highest standard of patient care and adherence to professional and ethical obligations. Question 6. Strategic planning requires a thorough understanding of a canine patient's complex health status when formulating a therapeutic diet. The patient is a 10-year-old Labrador Retriever diagnosed with chronic kidney disease, CKD, congestive heart failure, CHF, and a history of pancreatitis. The veterinarian has requested a diet that supports all three conditions. Which of the following approaches best reflects the principles of diet formulation in this scenario? Option A. Utilize a commercially available prescription diet formulated for kidney disease and assume it will adequately address the other concurrent conditions. Option B. Formulate a diet with moderately restricted phosphorus and sodium, a moderate protein level with high biological value, and a moderate fat content with added omega-3 fatty acids, prioritizing the CKD and CHF management while ensuring adequate caloric density to prevent malnutrition. Option C. Formulate a diet with extremely low fat content and high carbohydrate levels to prevent further pancreatic irritation, as this is the most recent diagnosis. Option D. Formulate a diet with very high protein and moderate fat content to support muscle mass, as the patient is a large breed dog, and address the CKD and CHF with supplements. The correct answer is B. Formulate a diet with moderately restricted phosphorus and sodium, a moderate protein level with high biological value, and a moderate fat content with added omega-3 fatty acids, prioritizing the CKD and CHF management while ensuring adequate caloric density to prevent malnutrition. Explanation. This scenario presents a common challenge in veterinary nutrition, where a veterinarian requests a diet formulation for a patient with multiple, potentially interacting health conditions. The challenge lies in balancing the nutritional requirements for each condition while avoiding contraindications or exacerbations. Careful judgment is required to prioritize the most critical health concerns and select ingredients and nutrient profiles that offer the greatest benefit with the least risk. The Certified Veterinary Technician Specialist, VTS, in nutrition must apply their knowledge of nutrient metabolism, disease pathophysiology, and ingredient properties to create a safe and effective diet. The correct approach represents best professional practice because it involves a systematic, evidence-based process that prioritizes patient safety and efficacy. It acknowledges the complexity of the case and the need for a comprehensive understanding of the patient's status. This approach aligns with the ethical responsibility to provide competent care and adhere to the scope of practice for a VTS in nutrition, which includes contributing to diet formulation under veterinary supervision. It also implicitly follows guidelines that emphasize thorough patient assessment and individualized care plans. An incorrect approach that focuses solely on one condition without considering others fails to address the holistic needs of the patient. This could lead to nutritional imbalances or exacerbate other health issues, violating the principle of do no harm. Another incorrect approach that relies on anecdotal evidence or unverified sources bypasses the scientific foundation of veterinary nutrition and risks recommending inappropriate or even harmful ingredients. This demonstrates a lack of due diligence and a failure to uphold professional standards of practice. Relying on a pre-formulated, generic diet without considering the specific nuances of the patient's multiple conditions is also problematic, as it may not adequately address all the patient's needs or could even be detrimental. Professional decision-making in such situations requires a structured approach. First, thoroughly review the patient's complete medical history and current diagnostic findings. Second, identify all active health conditions and their specific nutritional implications. Third, research the current scientific literature and establish nutritional guidelines for each condition. Fourth, consider potential interactions between nutrient requirements and contraindications. Fifth, collaborate closely with the supervising veterinarian to discuss the proposed formulation and obtain approval. Finally, document the rationale for all formulation decisions. Question 7. During the evaluation of a canine patient diagnosed with chronic kidney disease, CKD, a VTS nutrition is presented with the owner's strong preference for a specific commercially available diet that is not typically recommended for CKD due to its higher phosphorus content. The owner states they have had success with this diet for a previous pet with a different condition. The VTS has also reviewed the patient's current blood work, which indicates elevated phosphorus levels consistent with the CKD diagnosis. What is the most appropriate next step for the VTS? Option A. Recommend the owner's preferred diet, assuming the owner has prior positive experience and trusting their judgment regarding their pet's dietary needs. Option B. Advise the owner that their preferred diet is unsuitable and insist on a specific prescription kidney diet without further discussion or exploration of alternatives. Option C. Proceed with recommending a standard maintenance diet, as the owner's preference is secondary to the VTS's professional opinion on general canine nutrition. Option D. Discuss the owner's preference with the veterinarian, highlighting the potential risks of the preferred diet given the patient's elevated phosphorus levels and CKD diagnosis, and collaboratively explore alternative, kidney-friendly diets that may also be palatable and acceptable to the owner. Correct answer is D. Discuss the owner's preference with the veterinarian, highlighting the potential risks of the preferred diet given the patient's elevated phosphorus levels and CKD diagnosis, and collaboratively explore alternative, kidney-friendly diets that may also be palatable and acceptable to the owner. Explanation: this scenario is professionally challenging because it requires the Certified Veterinary Technician Specialist, VTS, in nutrition to interpret complex dietary information for a patient with a specific medical condition, balancing scientific evidence with the owner's practical constraints. The VTS must ensure the dietary recommendations are not only nutritionally sound, but also align with the veterinary diagnosis and are feasible for the client to implement, all while adhering to the ethical and regulatory standards governing veterinary practice. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that directly addresses the patient's diagnosed condition and integrates owner input. This aligns with the VTS nutrition scope of practice, which includes developing and implementing nutritional plans under veterinary supervision. By considering the patient's specific needs, the veterinary diagnosis, and the owner's ability to comply, the VTS ensures a safe, effective, and sustainable nutritional intervention. This approach upholds the ethical obligation to act in the best interest of the animal patient and to provide clear, actionable advice to the owner, fostering a collaborative approach to patient care. An incorrect approach that focuses solely on the owner's preference without a thorough assessment of the patient's medical needs would be a regulatory and ethical failure. It could lead to a suboptimal or even harmful dietary plan, potentially exacerbating the patient's condition and violating the duty of care owed to the animal. Another incorrect approach that relies on generalized dietary advice without considering the specific diagnosis or the patient's current nutritional status would also be professionally unacceptable. This demonstrates a lack of specialized knowledge and a failure to apply the principles of veterinary nutrition effectively, potentially leading to adverse outcomes and contravening the standards expected of a VTS. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's medical history and current diagnosis. This is followed by an objective assessment of the patient's nutritional status and requirements. The VTS should then research and evaluate available dietary options, considering scientific literature and evidence-based guidelines relevant to the specific condition. Crucially, open communication with the veterinarian and the owner is essential to integrate the patient's medical needs with the owner's lifestyle, financial constraints, and ability to administer the diet. The final recommendation should be a well-reasoned, individualized plan that is both therapeutically appropriate and practically achievable. Question 8. Operational review demonstrates that a Certified Veterinary Technician Specialist, VTS, in nutrition is tasked with formulating a long-term dietary plan for a healthy adult rabbit, considering the unique digestive adaptations of lagomorphs, Which of the following dietary approaches best aligns with species-specific physiological requirements and best professional practice? Option A. A diet primarily consisting of high-fiber hay, supplemented with a limited amount of fresh leafy greens and a small portion of high-quality pelleted food formulated for rabbits. Option B. A diet rich in grains, seeds, and dried fruits, mimicking a common rodent mix often fed to small mammals. Option C. A diet formulated with high protein and fat content, similar to that recommended for adult cats or dogs. Option D. A diet predominantly composed of cooked vegetables and starchy root vegetables, with minimal fiber content. Correct answer is A. A diet primarily consisting of high-fiber hay, supplemented with a limited amount of fresh leafy greens and a small portion of high-quality pelleted food formulated for rabbits. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Veterinary Technician Specialist, VTS, in nutrition to apply species-specific knowledge of digestive physiology to a practical nutritional recommendation. Misinterpreting or failing to account for these adaptations can lead to suboptimal or even harmful dietary plans, directly impacting animal health and well-being. The VTS must navigate the nuances of different digestive systems to ensure the chosen diet is not only palatable and meets nutritional requirements, but is also physiologically appropriate for the species. Correct approach analysis. The correct approach involves selecting a diet that aligns with the specific digestive capabilities of the target species. For a rabbit, this means prioritizing high-fiber, low-starch ingredients that mimic their natural diet and support hindgut fermentation. This approach is best professional practice because it adheres to the fundamental principles of veterinary nutrition, which emphasize species-appropriate care. Ethically, it fulfills the VTS's duty to provide evidence-based, safe, and effective nutritional guidance. Regulatory frameworks for veterinary practice, while not explicitly detailing every species' digestive tract, mandate that practitioners act in the best interest of the animal and utilize their specialized knowledge to do so. Incorrect approaches analysis. One incorrect approach involves recommending a diet primarily composed of grains and seeds, similar to that fed to some birds or rodents. This fails to acknowledge the rabbit's obligate herbivorous nature and their reliance on secotrophy, a process facilitated by a high-fiber diet. Feeding a high-grain diet can lead to gastrointestinal stasis, dental disease, and obesity, representing a failure to provide competent care and potentially violating ethical guidelines regarding animal welfare. Another incorrect approach is to suggest a diet rich in protein and fat, often formulated for carnivores or omnivores. Rabbits have a relatively low requirement for protein and fat compared to other species, and excessive amounts can overwhelm their digestive system, leading to dysbiosis and other health issues. This approach demonstrates a lack of understanding of species-specific nutritional needs and digestive physiology, which is a core competency for a VTS in nutrition. A third incorrect approach is to recommend a diet that is low in fiber. Rabbits require a significant amount of fiber to maintain gut motility and health. A low-fiber diet can lead to serious gastrointestinal problems, including ileus and enteritis. This directly contradicts established nutritional guidelines for lagomorphs and represents a significant failure in professional judgment and application of specialized knowledge. Professional reasoning. When faced with a nutritional case, a VTS in nutrition must first identify the species and then access and apply their specialized knowledge regarding that species' unique physiology, including its digestive adaptations. This involves understanding dietary preferences, nutrient requirements, and the mechanics of digestion. The decision-making process should involve 1. Species identification. 2. Review of species-specific nutritional requirements and digestive physiology. 3. Assessment of the individual animal's health status and needs. 4. Selection of a diet that meets all these criteria. 5. Ongoing monitoring and adjustment as necessary. This systematic approach ensures that recommendations are safe, effective, and ethically sound, upholding the standards of specialized veterinary care. Question 9. The evaluation methodology shows a canine patient diagnosed with hypothyroidism. The veterinarian has requested a nutritional recommendation to support the patient's energy needs, acknowledging that the condition significantly impacts metabolic rate. The veterinary technician specialist in nutrition is presented with several potential approaches to determine the patient's energy requirements. Which approach best aligns with current veterinary nutrition principles and ethical standards for managing a patient with a hypermetabolic state? Option A. Advise the veterinarian that determining energy requirements for a hypothyroid patient is too complex and suggest they consult a board-certified veterinary nutritionist without providing any initial assessment or recommendation. Option B. Recommend a diet based on the technician's experience with similar-looking dogs, prioritizing palatability and ease of feeding, without specific calculation or reference to the hyperthyroid diagnosis. Option C. Utilize established veterinary nutrition guidelines and resources that provide specific recommendations or adjustment factors for hypothyroid conditions to modify the RER or MER, considering the increased metabolic demand. Option D. Calculate the standard resting energy requirement, RER, for a healthy dog of similar size, and then apply a standard multiplier for a sick animal without further disease-specific adjustments. The correct answer is D. Calculate the standard resting energy requirement, RER, for a healthy dog of similar size, and then apply a standard multiplier for a sick animal without further disease-specific adjustments. Explanation. The evaluation methodology shows a common challenge in veterinary nutrition, accurately determining a patient's energy requirements without relying solely on basic formulas, especially when dealing with a complex case. This scenario is professionally challenging because it requires the technician to move beyond simple calculations and apply a nuanced understanding of physiological factors influencing energy expenditure. The veterinarian has provided a diagnosis that directly impacts metabolic rate, necessitating a more sophisticated approach than a standard maintenance energy requirement (MER) calculation. The technician must consider how the disease state alters the patient's resting energy expenditure (RE) and adjust their recommendations accordingly, demonstrating a deep understanding of nutritional principles and their application in clinical practice. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that integrates the patient's specific condition with established nutritional guidelines. By considering the impact of hyperthyroidism on metabolic rate and referencing established veterinary nutrition resources for disease-specific adjustments to energy needs, the technician is providing a scientifically sound and ethically responsible recommendation. This aligns with the VTS nutrition's role in providing expert advice and supporting the veterinarian's treatment plan, ensuring the patient receives appropriate nutritional support for optimal recovery and management. Adherence to these principles is implicitly guided by the overarching ethical standards of veterinary practice, which mandate providing the highest quality of care based on current knowledge and evidence. An incorrect approach that relies solely on a standard MER calculation for a healthy adult dog fails to account for the significant metabolic alterations caused by hyperthyroidism. This represents a regulatory and ethical failure because it could lead to underfeeding or overfeeding the patient, both of which can exacerbate the condition or lead to other complications. Such an approach demonstrates a lack of critical thinking and an insufficient understanding of how disease processes impact nutritional requirements, falling short of the expected standard of care for a VTS nutrition. Another incorrect approach that involves guessing the patient's energy needs based on subjective observations, without referencing any established methodologies or considering the diagnosed condition, is also professionally unacceptable. This is a direct ethical failure, as it constitutes practicing without a sound scientific basis and could result in significant harm to the patient. It disregards the importance of evidence-based practice and the VTS nutrition's responsibility to provide informed recommendations. A further incorrect approach that involves recommending a diet without any consideration for the patient's specific energy requirements, focusing only on palatability or convenience, is similarly flawed. This neglects the fundamental principle of nutritional therapy, which is to meet the patient's metabolic demands. Ethically, this is a failure to provide appropriate nutritional guidance, potentially leading to malnutrition or obesity, and undermining the therapeutic goals of the veterinary team. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly understanding the patient's diagnosis and its known physiological impacts on metabolism. Second, consulting reliable veterinary nutrition resources and guidelines, particularly those that address disease-specific energy requirements. Third, critically evaluating the applicability of standard calculations in light of the patient's condition. Finally, collaborating with the veterinarian to formulate a tailored nutritional plan that addresses the patient's unique needs, ensuring the recommendation is both scientifically accurate and ethically sound. Question 10. Regulatory review indicates that a hospitalized canine patient diagnosed with acute pancreatitis is showing a decreased appetite and mild lethargy. The veterinary team has initiated a therapeutic diet. Which of the following approaches best reflects best practice for nutritional monitoring in this scenario, adhering strictly to established veterinary nutrition guidelines and VTS scope of practice? Option A. Reassess the patient's body condition score, hydration status, appetite, and voluntary food intake daily, and adjust the diet or feeding method as indicated by clinical signs and any available biochemical data. Option B. Continue with the initiated therapeutic diet for a predetermined period, assuming the patient will gradually improve without further specific nutritional assessments. Option C. Prioritize the owner's preference for a different, non-therapeutic diet if the patient shows any reluctance to eat the prescribed food, without further consultation on nutritional implications. Option D. Rely solely on the initial diagnosis to guide the feeding plan, assuming the patient's nutritional needs will remain static throughout hospitalization. The correct answer is A. Reassess the patient's body condition score, hydration status, appetite, and voluntary food intake daily, and adjust the diet or feeding method as indicated by clinical signs and any available biochemical data. Explanation. This scenario is professionally challenging because the nutritional status of hospitalized patients is dynamic and directly impacts their recovery, immune function, and overall prognosis. A VTS specializing in nutrition must integrate clinical observations with scientific principles and regulatory guidelines to ensure optimal patient care. The complexity arises from the need to continuously assess, adapt, and document nutritional interventions, often in the face of patient instability, concurrent medical conditions, and varying owner compliance. Careful judgment is required to balance immediate nutritional needs with long-term health goals, and to communicate effectively with the veterinary team and owners. The correct approach represents best professional practice because it aligns with the core principles of veterinary nutrition and the ethical obligations of a VTS. Continuous monitoring, including regular assessment of body condition score, hydration status, appetite, intake, and relevant biochemical parameters, allows for timely adjustments to the nutritional plan. This proactive approach minimizes the risk of malnutrition or overfeeding, supports healing, and prevents complications. Adherence to established veterinary nutrition guidelines and the VTS scope of practice, as defined by relevant professional bodies and regulatory frameworks within the specified jurisdiction, ensures that interventions are evidence-based, safe, and effective. Documentation of all assessments and interventions is crucial for continuity of care, legal protection, and professional accountability. An incorrect approach that relies solely on initial dietary recommendations, without ongoing reassessment, fails to acknowledge the dynamic nature of a hospitalized patient's nutritional needs. This can lead to inadequate support or iatrogenic complications, violating the ethical duty to provide competent care and potentially contravening guidelines that emphasize patient monitoring. Another incorrect approach that prioritizes owner preference over evidence-based nutritional recommendations, without thorough discussion and informed consent regarding the risks and benefits, represents a failure in professional judgment and ethical responsibility. This can compromise patient welfare and undermine the VTS's role in advocating for optimal nutritional care. An approach that neglects to document nutritional assessments and interventions is a significant regulatory and ethical failure. Inadequate record-keeping hinders communication among the veterinary team, impedes continuity of care, and can have serious legal ramifications. Failing to meet the standards of professional practice and regulatory requirements for medical records. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the patient's current nutritional status and any contributing factors. 2. Develop an evidence-based nutritional plan, considering the patient's specific condition, species, age, and life stage. 3. Implement the plan and establish a schedule for regular monitoring and reassessment. 4. Continuously evaluate the patient's response to the nutritional intervention, making adjustments as needed. 5. Maintain accurate and detailed records of all assessments, interventions, and outcomes. 6. Communicate effectively with the veterinary team and owners, ensuring they understand the rationale behind the nutritional plan and any necessary adjustments. Question 11. The efficiency study reveals that a canine patient exhibits suboptimal nutrient utilization despite consuming a diet formulated with appropriate macronutrient profiles. Further investigation into the animal's digestive processes indicates potential inefficiencies in the breakdown and absorption of fats and proteins, leading to variable stool quality and reduced energy levels. Which of the following approaches would best optimize the animal's digestive efficiency and overall health within the scope of a VTS nutrition's responsibilities in the United States? Option A. Conduct a detailed analysis of the animal's fecal output, including enzymatic activity and microbial populations, to identify specific digestive enzyme deficiencies or dysbiosis, and then tailor a dietary intervention focusing on highly digestible ingredients, potentially supplemented with specific probiotics or probiotics, and consider the use of targeted digestive enzyme supplements if indicated by diagnostic findings. Option B. Advise the owner to increase the quantity of food offered to compensate for the perceived poor nutrient absorption, assuming the animal is simply not eating enough to meet its needs. Option C. Recommend a switch to a sensitive stomach commercial diet, as these are generally formulated for improved digestibility and may alleviate the observed symptoms. Option D. Suggest the owner try various over-the-counter digestive aids and observe for any improvement in stool quality or energy levels over a 2-week period. The correct answer is A. Conduct a detailed analysis of the animal's fecal output, including enzymatic activity and microbial populations, to identify specific digestive enzyme deficiencies or dysbiosis, and then tailor a dietary intervention focusing on highly digestible ingredients, potentially supplemented with specific probiotics or probiotics, and consider the use of targeted digestive enzyme supplements if indicated by diagnostic findings. Explanation. This scenario presents a professional challenge because it requires the Certified Veterinary Technician Specialist, VTS, in nutrition to interpret complex physiological data and translate it into actionable dietary recommendations, all while adhering to the strict regulatory framework governing veterinary practice and nutrition in the United States. The VTS must balance the animal's immediate physiological needs with long-term health outcomes and the owner's ability to implement the recommendations, all within the scope of practice defined by veterinary licensing boards. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the animal's digestive processes. This involves not just observing gross outcomes, but understanding the underlying mechanisms of ingestion, digestion, absorption, and metabolism. By integrating data from multiple sources, including diagnostic tests and clinical observations, the VTS can identify specific points of inefficiency or dysfunction. This holistic approach aligns with the ethical obligation to provide the highest standard of care and the regulatory requirement to practice within one's specialized knowledge and skills. It also ensures that recommendations are tailored to the individual animal's needs, promoting optimal nutrient utilization and health, which is the core tenet of veterinary nutrition. An incorrect approach that focuses solely on the animal's current body condition score, BCS, fails to address the root cause of any potential digestive inefficiencies. While BCS is an important metric, it is a consequence, not a cause, of digestive processes. Relying solely on BCS without investigating the underlying digestive function could lead to inappropriate dietary adjustments that do not resolve the primary issue, potentially exacerbating the problem or masking other underlying health concerns. This could be considered a failure to provide adequate care and potentially a violation of practice acts that require a thorough diagnostic approach. Another incorrect approach that involves recommending a generic, over-the-counter digestive support supplement without a specific diagnosis of a digestive disorder is ethically problematic and potentially violates regulatory guidelines. Such recommendations lack specificity and may not address the animal's actual needs. Furthermore, without a proper diagnosis, the VTS cannot ensure the supplement is safe or effective for the particular animal, nor can they justify its use within the scope of their specialized practice. This could be seen as practicing outside the bounds of their expertise and failing to uphold the standard of care expected of a VTS. A third incorrect approach that involves making drastic changes to the diet based on anecdotal evidence or marketing claims from pet food manufacturers, without consulting peer-reviewed literature or conducting a thorough diagnostic workup, is a significant regulatory and ethical failure. This approach disregards the scientific basis of veterinary nutrition and the VTS's responsibility to provide evidence-based recommendations. It could lead to adverse health outcomes for the animal and undermine the credibility of the veterinary profession. This directly contravenes the principles of responsible veterinary practice and the ethical duty to act in the animal's best interest. The professional reasoning process should involve a systematic evaluation of the animal's history, clinical signs, and diagnostic data. The VTS should then identify specific areas of concern within the digestive processes: ingestion, digestion, absorption, metabolism. Based on this analysis, it should formulate a differential diagnosis for any observed inefficiencies. The next step is to develop a targeted intervention plan, which may include dietary modifications, diagnostic testing, or referral to a veterinarian for further medical management. Throughout this process, the VTS must continuously monitor the animal's response to the intervention and adjust the plan as needed, always documenting their findings and recommendations. This systematic, evidence-based approach ensures that care is both effective and compliant with professional standards. Question 12. Quality control measures reveal that a canine patient undergoing nutritional therapy for chronic kidney disease is exhibiting signs of severe dehydration, including decreased skin turgor and sunken eyes, despite receiving a specialized renal diet. The veterinary team is debating whether to immediately adjust fluid therapy or focus on optimizing the macronutrient and micronutrient balance of the current diet. As a VTS in nutrition, which action is the absolute priority to ensure the patient's well-being and the efficacy of nutritional interventions? Option A. Focus on adjusting the mineral content of the diet to reduce the workload on the kidneys. Option B. Recommend a diet with a higher protein content to support muscle mass. Option C. Increase the caloric density of the current renal diet to compensate for potential metabolic stress. Option D. Initiate aggressive fluid therapy to correct the severe dehydration. The correct answer is D. Initiate aggressive fluid therapy to correct the severe dehydration. Explanation. Scenario analysis. This scenario presents a challenge in a clinical setting where a veterinary technician specialist in nutrition must interpret potentially conflicting information regarding a patient's hydration status and its impact on nutritional therapy. The technician must apply their specialized knowledge of water's physiological importance and functions within the strict regulatory framework governing veterinary practice and nutrition, ensuring patient safety and adherence to established protocols. The challenge lies in discerning the most critical factor influencing the patient's overall health and the efficacy of nutritional interventions. Correct approach analysis. The correct approach prioritizes addressing the fundamental physiological need for adequate hydration. Water is essential for virtually all bodily functions, including nutrient transport, waste elimination, thermoregulation, and cellular metabolism. Without sufficient water, a patient cannot effectively utilize nutrients, and metabolic processes are severely compromised. Therefore, ensuring proper hydration is a prerequisite for successful nutritional support and is a core responsibility within the scope of veterinary technician practice, particularly for a VTS in nutrition. This aligns with the ethical obligation to provide the highest standard of care and the regulatory expectation that veterinary professionals will address life-sustaining physiological needs. Incorrect approaches analysis. One incorrect approach would be to focus solely on the caloric or macronutrient content of the diet without first addressing the severe dehydration. This fails to recognize that nutrient absorption and utilization are critically dependent on adequate hydration. Ethically, this represents a failure to prioritize immediate life-sustaining needs. From a regulatory standpoint, it could be seen as practicing nutrition without considering fundamental physiological requirements, potentially leading to patient harm. Another incorrect approach would be to assume that the prescribed diet alone will resolve the hydration issue. Some therapeutic diets may have higher moisture content. They are not a substitute for direct fluid therapy when a patient is significantly dehydrated. This approach neglects the direct physiological impact of dehydration and the need for targeted interventions. It demonstrates a lack of understanding of the interplay between hydration and nutrition, which is a core competency for a VTS in nutrition. A further incorrect approach would be to dismiss the dehydration as a minor issue that will resolve on its own or with minimal intervention, focusing instead on long-term nutritional goals. This demonstrates a critical lapse in judgment and a failure to recognize the immediate threat posed by severe dehydration. It is a direct contravention of the principle of providing prompt and appropriate care for acute conditions, which is a fundamental ethical and regulatory requirement in veterinary medicine. Professional reasoning. When faced with a situation involving both nutritional concerns and significant physiological derangements like dehydration, a veterinary technician specialist in nutrition must employ a hierarchical approach to patient care. The immediate priority is always to stabilize and support critical physiological functions. In this case, addressing severe dehydration is paramount. Once the patient is adequately hydrated, the nutritional plan can be more effectively implemented and its success monitored. This decision-making process involves assessing the patient's overall status, identifying the most immediate threats to life and well-being, and applying specialized knowledge to address these threats in a logical and prioritized sequence, always adhering to the scope of practice and ethical guidelines. Question 13. Implementation of a comprehensive nutritional management plan for a newly diagnosed canine patient with diabetes mellitus, considering the veterinarian's diagnosis and treatment protocol. What is the most appropriate initial approach for a certified veterinary technician specialist, VTS, in nutrition? Option A. Provide the owner with general guidelines for feeding diabetic dogs, emphasizing low-fat and high-fiber options, without specific product recommendations. Option B. Develop a detailed feeding plan, including specific food recommendations and portion sizes, in direct consultation with the attending veterinarian, and educate the owner on the principles of diabetic nutrition and consistent feeding schedules. Option C. Independently select and recommend a specific prescription diet known for its diabetic management properties, providing the owner with feeding instructions. Option D. Advise the owner to continue with the current diet as long as the dog is eating, and to monitor for signs of worsening symptoms before considering dietary changes. The correct answer is B. Develop a detailed feeding plan, including specific food recommendations and portion sizes, in direct consultation with the attending veterinarian, and educate the owner on the principles of diabetic nutrition and consistent feeding schedules. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified veterinary technician specialist, VTS, in nutrition to balance immediate client needs with long-term patient health outcomes, all while adhering to specific regulatory guidelines for nutritional recommendations. The client's emotional distress and desire for a quick fix can create pressure to deviate from evidence-based protocols. The VTS must navigate this by providing clear, actionable, and compliant advice that empowers the client to manage their pet's diabetes effectively. The challenge lies in translating complex nutritional science into practical, client-understandable advice that respects the veterinarian's ultimate diagnostic and treatment authority. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a collaborative, evidence-based, and client-centered strategy. It acknowledges the veterinarian's primary role in diagnosis and treatment planning, ensuring the VTS's recommendations are integrated within the established veterinary care plan. This approach emphasizes client education on the principles of diabetic nutrition, focusing on consistency, appropriate macronutrient profiles, and the importance of monitoring. It also involves developing a tailored feeding plan in consultation with the veterinarian, which is crucial for managing blood glucose levels and preventing complications. This aligns with ethical veterinary practice, which mandates acting in the best interest of the animal patient and maintaining professional boundaries. Regulatory frameworks for veterinary technicians, particularly specialists, often emphasize working under veterinary supervision and providing advice that supports the veterinarian's treatment plan. This approach ensures the VTS is operating within their scope of practice and providing safe, effective nutritional guidance. Incorrect approaches analysis. One incorrect approach involves the VTS independently prescribing a specific prescription diet without explicit veterinary authorization. This is a regulatory and ethical failure because it oversteps the VTS's scope of practice, which typically requires veterinary direction for prescription diets. It bypasses the veterinarian's diagnostic assessment and treatment plan, potentially leading to inappropriate caloric intake or nutrient profiles for the specific stage or type of diabetes, or for other coexisting conditions. This could result in poor glycemic control, adverse health effects, and a breakdown in the veterinary client-patient relationship. Another incorrect approach is to provide generalized dietary advice without considering the individual patient's specific needs, current health status, or the veterinarian's treatment plan. This fails to meet the standard of care for a VTS in nutrition, who is expected to provide specialized, individualized recommendations. It is ethically problematic as it may not adequately address the complexities of diabetes management and could lead to suboptimal outcomes. From a regulatory standpoint, it demonstrates a lack of professional diligence and expertise expected of a specialist. A third incorrect approach is to focus solely on the client's perceived ease of feeding or cost, without adequately addressing the physiological requirements for diabetes management. While client compliance is important, it should not supersede the fundamental nutritional principles necessary for controlling blood glucose and maintaining the pet's health. This approach prioritizes convenience over efficacy and safety, which is a significant ethical lapse and a failure to uphold the VTS's responsibility to the animal patient. It also risks mismanaging the condition, leading to complications that could have been prevented with appropriate nutritional guidance. Professional reasoning. Professionals should approach such situations by first confirming the diagnosis and current treatment plan with the attending veterinarian. They should then engage the client in a discussion about the pet's condition and the role of nutrition, using clear and understandable language. The VTS should gather detailed information about the pet's current diet, feeding schedule, and any observed symptoms. Based on this information and in collaboration with the veterinarian, the VTS should then formulate specific, evidence-based nutritional recommendations, including appropriate food types, feeding amounts, and schedules, always prioritizing the pet's well-being and adherence to veterinary directives. Client education should be ongoing, and regular follow-up with both the client and veterinarian is essential to monitor progress and make necessary adjustments. Question 14. Governance review demonstrates that a certified veterinary technician specialist, VTS, nutrition is tasked with developing a dietary management plan for a canine patient diagnosed with chronic pancreatitis and concurrent inflammatory bowel disease. The diagnostic workup includes blood work, fecal analysis, and abdominal ultrasound. The attending veterinarian has provided the VTS with the diagnostic reports and a general directive to optimize the diet for gut health and fat malabsorption. The VTS must consider how to best approach this complex nutritional challenge. Which of the following approaches best aligns with the professional responsibilities and ethical guidelines for a VTS nutrition specialist in this scenario? A. Conduct a thorough review of the patient's complete medical record and diagnostic results. Consult with the attending veterinarian to clarify specific dietary goals and constraints, and then formulate a detailed, evidence-based nutritional recommendation that addresses both pancreatitis and IBD, including specific macronutrient profiles, palatability considerations, and owner education on feeding strategies. B. Provide the owner with a list of commercially available sensitive stomach or low-fat dog foods, advising them to choose one that their dog tolerates best, and suggest they monitor for any changes in stool quality or appetite. C. Recommend a proprietary blend of digestive enzymes and probiotics available over the counter, without specific veterinary prescription or guidance on dosage, and instruct the owner to administer these alongside their dog's current diet. D. Advise the owner to feed a highly restrictive homemade diet consisting only of boiled chicken and white rice, as this is a common recommendation for gastrointestinal upset, and to observe for improvement over the next week. Option A. Conduct a thorough review of the patient's complete medical record and diagnostic results. Consult with the attending veterinarian to clarify specific dietary goals and constraints, and then formulate a detailed, evidence-based nutritional recommendation that addresses both pancreatitis and IBD, including specific macronutrient profiles, palatability considerations, and owner education on feeding strategies. Option B. Provide the owner with a list of commercially available sensitive stomach or low-fat dog foods, advising them to choose one that their dog tolerates best, and suggest they monitor for any changes in stool quality or appetite. Option C. Advise the owner to feed a highly restrictive homemade diet consisting only of boiled chicken and white rice, as this is a common recommendation for gastrointestinal upset, and to observe for improvement over the next week. Option D. Recommend a proprietary blend of digestive enzymes and probiotics available over the counter, without specific veterinary prescription or guidance on dosage, and instruct the owner to administer these alongside their dog's current diet. The correct answer is A. Conduct a thorough review of the patient's complete medical record and diagnostic results. Consult with the attending veterinarian to clarify specific dietary goals and constraints, and then formulate a detailed, evidence-based nutritional recommendation that addresses both pancreatitis and IBD, including specific macronutrient profiles, palatability considerations, and owner education on feeding strategies. Explanation. This scenario presents a professional challenge due to the need to balance immediate patient needs with long-term dietary management and owner compliance, all within the scope of veterinary technician practice as defined by the VTS Nutrition Credentialing Body and relevant state veterinary practice acts. The VTS Nutrition Credential signifies advanced knowledge and skills in nutritional support, requiring the technician to operate at a higher level of independent judgment and client education than a general practice technician. The challenge lies in interpreting complex diagnostic information, formulating a tailored nutritional plan, and effectively communicating this plan to the owner in a way that ensures adherence and positive outcomes, while respecting the veterinarian's ultimate diagnostic and treatment authority. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and collaborative approach. It involves a thorough review of the patient's history and diagnostic results, consultation with the attending veterinarian to ensure alignment with the overall treatment plan, and the development of a detailed, owner-friendly nutritional recommendation. This aligns with the ethical and professional responsibilities of a VTS nutrition specialist to provide expert advice and support, empowering owners to manage their pet's condition effectively. It also adheres to the principle of working under veterinary supervision, ensuring that all nutritional interventions are integrated into the broader medical care of the animal. An incorrect approach that focuses solely on providing a generic dietary recommendation without considering the specific diagnostic findings or consulting the veterinarian fails to meet the advanced standards expected of a VTS nutrition specialist. This could be considered a failure to uphold the credential's value and potentially a deviation from the scope of practice, as it bypasses essential diagnostic interpretation and veterinary oversight. Ethically, it could lead to suboptimal patient care if the generic recommendation is not appropriate for the specific underlying condition. Another incorrect approach that involves recommending over-the-counter supplements without veterinary diagnosis or prescription is a significant regulatory and ethical failure. Veterinary practice acts typically restrict the dispensing or recommending of medications and therapeutic diets to licensed veterinarians. A VTS nutrition specialist is expected to work within these legal boundaries and to advocate for evidence-based, veterinarian-approved interventions. Recommending unproven or inappropriate supplements can be harmful to the patient and exposes the technician and practice to liability. A third incorrect approach that involves deferring all nutritional decisions to the owner without providing expert guidance or education is also professionally deficient. While owner input is crucial for compliance, the VTS nutrition specialist's role is to provide informed recommendations based on their specialized knowledge. Failing to do so abdicates professional responsibility and may lead to owner confusion or poor decision-making, ultimately impacting the patient's health. This neglects the core purpose of the VTS nutrition credential, which is to provide expert nutritional guidance. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available patient information, including history, physical examination findings, and diagnostic results. 2. Consult with the attending veterinarian to understand the complete diagnostic picture and treatment goals. 3. Formulate a nutritional plan that is evidence-based, tailored to the patient's specific condition and needs, and considers owner capabilities and preferences. 4. Clearly communicate the nutritional plan, rationale, and expected outcomes to the owner, providing education and addressing concerns. 5. Document all recommendations and communications. 6. Continuously monitor patient progress and adjust the plan as needed in consultation with the veterinarian. Question 15. The performance metrics show a significant increase in client inquiries regarding home-cooked diets for their pets, with a notable percentage of owners expressing a desire to transition their animals away from commercial diets due to perceived health benefits or ingredient concerns. Given this trend, which of the following actions best aligns with regulatory requirements and ethical best practices for a certified veterinary technician specialist, VTS, in nutrition in the United States? Option A. Advise the client that home-cooked diets are inherently risky and strongly discourage their use, suggesting they strictly adhere to commercially available veterinary therapeutic diets. Option B. Provide the client with a general template for a home-cooked diet, emphasizing the importance of variety in ingredients, and advise them to monitor their pet for any adverse reactions. Option C. Offer to create a home-cooked diet plan based on common internet recipes, assuring the client that these are generally safe and effective for most pets. Option D. Recommend a consultation with a board-certified veterinary nutritionist or a veterinarian with advanced training in nutrition to formulate a balanced home-cooked diet tailored to the individual pet's needs. The correct answer is D. Recommend a consultation with a board-certified veterinary nutritionist or a veterinarian with advanced training in nutrition to formulate a balanced home-cooked diet tailored to the individual pet's needs. Explanation. The performance metrics show a concerning trend in client compliance with veterinary-recommended diets, with a significant portion of owners opting for home-cooked meals without proper veterinary nutritionist guidance. This scenario is professionally challenging because it directly impacts patient health and welfare, creating a conflict between client autonomy and the veterinarian's ethical and legal responsibility to provide competent care. The complexity arises from balancing client desires with the inherent risks of unbalanced nutrition, which can lead to serious health consequences for the animal. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based veterinary medicine, aligning with the core principles of veterinary practice acts and professional conduct guidelines. By advocating for consultation with a board-certified veterinary nutritionist or a veterinarian with advanced training in nutrition, the technician is upholding their duty of care. This ensures that any home-cooked diet is formulated to meet the specific nutritional requirements of the individual patient, considering their life stage, health status, and any concurrent medical conditions. This approach is compliant with regulations that mandate providing care within the scope of one's knowledge and skills, and when specialized knowledge is required, referring to a qualified professional. It also aligns with ethical obligations to prevent harm and promote animal well-being. An incorrect approach that involves providing a generic home-cooked diet recipe without individual assessment or referral to a specialist is a significant regulatory and ethical failure. This action constitutes practicing veterinary medicine without proper authorization or expertise, as formulating a balanced diet for a specific animal is a diagnostic and therapeutic act. It violates the principle of do no harm by exposing the animal to the risks of nutritional deficiencies or excesses, which can exacerbate existing conditions or create new health problems. Such an action could be considered negligence and may lead to disciplinary action by the Veterinary Licensing Board. Another incorrect approach, such as dismissing the client's desire for a home-cooked diet and refusing to discuss any alternatives, is also professionally problematic. While it avoids the risks of an unbalanced diet, it fails to address the client's concerns and may damage the client-veterinarian relationship, potentially leading the client to seek advice from unqualified sources. This approach lacks the collaborative and educational aspect of best practice. The professional decision-making process for similar situations should involve a thorough assessment of the client's request, an evaluation of the potential risks and benefits of home-cooked diets for the specific patient, and a clear communication strategy. When a client expresses interest in home-cooked diets, the professional should first educate them on the complexities and risks involved. If the client remains committed, the best practice is to facilitate a consultation with a veterinary nutritionist or a veterinarian with advanced nutritional expertise. This ensures that the patient receives appropriate care while respecting the client's wishes within safe and ethical boundaries. Question 16. Governance review demonstrates that a commercial pet food manufacturer has provided marketing materials for a new diet that highlight its novel protein sources and enhanced digestibility. As a certified veterinary technician specialist, VTS, in nutrition, What is the most appropriate initial step to evaluate the nutritional adequacy and regulatory compliance of this diet for a specific canine life stage? Adhering strictly to U.S. regulatory frameworks. Option A. Verify that the diet's labeling includes an OFCO nutritional adequacy statement for the intended canine life stage, and review the guaranteed analysis to ensure it aligns with OFCO nutrient profiles. Option B. Seek testimonials from other veterinary professionals who have used the diet and report positive client feedback. Option C. Examine the ingredient list for the presence of high-quality, recognizable ingredients, assuming this directly correlates with nutritional completeness. Option D. Prioritize the manufacturer's claims regarding novel protein sources and enhanced digestibility as indicators of superior nutritional value. The correct answer is A. Verify that the diet's labeling includes an OFCO nutritional adequacy statement for the intended canine life stage, and review the guaranteed analysis to ensure it aligns with OFCO nutrient profiles. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Veterinary Technician Specialist, VTS, in nutrition to critically evaluate commercial diet information presented by a manufacturer, which may be biased, against established regulatory standards. The challenge lies in discerning factual claims supported by evidence and regulatory compliance from marketing language that might overstate benefits or omit crucial details. The VTS must navigate potential conflicts of interest and ensure the information provided to clients is accurate, safe, and ethically sound, directly impacting animal health and client trust. Correct approach analysis. The correct approach involves a thorough review of the commercial diet's labeling and marketing materials, specifically cross-referencing claims against the Association of American Feed Control Officials, OFCO, nutritional standards and guidelines. This aligns with best professional practice by prioritizing evidence-based evaluation and adherence to regulatory requirements. OFCO standards provide the benchmark for nutritional adequacy and labeling accuracy, ensuring that diets meet the physiological needs of the target animal life stage and species. By focusing on OFCO compliance, the VTS upholds their ethical responsibility to provide accurate information and protect animal welfare, as mandated by Professional Veterinary Technician Practice Acts and ethical codes that emphasize competence and client education. Incorrect approaches analysis. One incorrect approach involves accepting the manufacturer's marketing claims at face value without independent verification against OFCO standards. This represents a significant regulatory and ethical failure because it bypasses the established framework for ensuring nutritional adequacy and can lead to the recommendation of diets that are not truly complete and balanced, potentially harming the animal. It also fails to uphold the VTS's duty to provide objective, evidence-based advice. Another incorrect approach is to solely rely on anecdotal evidence or testimonials from other veterinary professionals or pet owners. While anecdotal information can sometimes offer insights, it is not a substitute for regulatory compliance and scientific validation. Relying on such information without verifying OFCO compliance is a regulatory failure, as it disregards the established standards for diet safety and efficacy. Ethically, it is a failure to provide the highest standard of care and informed guidance. A third incorrect approach is to focus exclusively on the palatability or ingredient list without considering the overall nutritional profile as defined by OFCO. While palatability and ingredient quality are important factors, they do not guarantee nutritional completeness. A diet may have desirable ingredients but still fail to meet OFCO minimum requirements for essential nutrients, or it may exceed maximums, leading to imbalances. This approach is a regulatory failure because it neglects the core purpose of OFCO standards, which is to ensure nutritional adequacy for the intended species and life stage. Professional reasoning. Professionals should approach the evaluation of commercial diets by first identifying the target species and life stage. Then, they must obtain the diet's guaranteed analysis and ingredient list. The critical next step is to verify if the diet is formulated to meet OFCO nutritional standards for the intended purpose, looking for OFCO statements on the packaging. This involves understanding what OFCO statements signify, e.g., complete and balanced for a specific life stage, and if necessary, requesting detailed nutritional information from the manufacturer to confirm compliance beyond the basic statement. This systematic, evidence-based approach, grounded in regulatory compliance, ensures that recommendations are safe, effective, and ethically sound, thereby protecting animal health and client trust. Question 17. Investigation of a canine patient diagnosed with chronic kidney disease, CKD, reveals that the prescribed low-protein, phosphorus-restricted therapeutic diet is being refused by the animal due to extreme pickiness. The owner is frustrated and considering switching to a different, less restrictive diet they believe the dog will eat, despite the veterinarian's clear instructions. What is the most appropriate course of action for the Certified Veterinary Technician Specialist, VTS, nutrition? Option A. Consult with the veterinarian to discuss potential palatability enhancers or alternative therapeutic diets that meet the CKD nutritional parameters while addressing the patient's aversion. Option B. Advise the owner to continue offering the prescribed diet and to withhold all other food until the dog eventually eats it to ensure adherence to the veterinarian's plan. Option C. Suggest the owner try adding significant amounts of table scraps or other highly palatable, non-therapeutic foods to the prescribed diet to encourage consumption. Option D. Recommend the owner immediately switch to a readily available kidney support diet from a pet food store that is not a prescription therapeutic diet, as it is likely more palatable. The correct answer is A. Consult with the veterinarian to discuss potential palatability enhancers or alternative therapeutic diets that meet the CKD nutritional parameters while addressing the patient's aversion. Explanation. This scenario presents a common implementation challenge in veterinary nutrition, adapting a prescribed therapeutic diet for a patient with concurrent, unrelated dietary preferences or aversions. The challenge lies in balancing the strict nutritional requirements of the primary disease with the practical reality of client compliance and patient acceptance, all while adhering to professional standards and ethical obligations. The veterinary technician specialist must navigate potential conflicts between the veterinarian's prescription, the owner's concerns, and the patient's well-being. The correct approach represents best professional practice because it prioritizes patient health and adherence to the veterinarian's therapeutic plan through collaborative problem-solving. It involves open communication with the veterinarian to explore modifications that maintain the diet's therapeutic integrity while addressing the patient's palatability issues. This aligns with the VTS nutrition's role in supporting the veterinarian's treatment plan and ensuring optimal patient outcomes through evidence-based nutritional interventions. Ethical practice demands that the technician acts in the best interest of the animal, which includes ensuring the prescribed diet is consumed. An incorrect approach that involves unilaterally substituting a different therapeutic diet without veterinary consultation is a significant regulatory and ethical failure. This bypasses the veterinarian's authority and expertise, potentially compromising the management of the primary disease. It violates the principle of acting under veterinary supervision and could lead to adverse health consequences for the patient if the substituted diet does not meet the specific therapeutic needs. Furthermore, it undermines the veterinarian-client-patient relationship by creating a lack of transparency and trust. Another incorrect approach, such as advising the owner to force-feed the animal or ignore the palatability issue, demonstrates a failure to recognize the importance of patient compliance and welfare. While adherence to the prescribed diet is crucial, methods that cause undue stress or suffering to the animal are ethically unacceptable. This approach neglects the practical realities of home care and the potential for negative associations with food, which can further complicate nutritional management. It also fails to leverage the VTS nutrition's expertise in problem-solving and patient-centered care. The professional reasoning process for similar situations should begin with a thorough understanding of the prescribed therapeutic diet's rationale and the specific nutritional goals for the patient's condition. When faced with compliance issues, the first step is always to communicate with the prescribing veterinarian to discuss the problem and explore potential solutions. This might involve seeking approval for minor palatability enhancers that do not compromise the diet's therapeutic properties, considering alternative formulations of the same diet, or, if necessary, exploring entirely different therapeutic diets that address both conditions, always under veterinary direction. Documentation of all communications and decisions is also a critical component of professional practice. Question 18. What factors determine the most appropriate enteral feeding tube type and placement technique for a critically ill canine patient experiencing anorexia and requiring nutritional support for an anticipated minimum of 2 weeks? Option A. patient's gastrointestinal tract patency, tolerance for tube placement, and anticipated duration of nutritional support. Option B, availability of different feeding tube sizes and the veterinarian's personal preference for a specific placement method. Option C, cost of the feeding tube and the ease with which it can be inserted by any veterinary team member. Option D, patient's breed and age, regardless of their current clinical condition or gastrointestinal function. The correct answer is A, patient's gastrointestinal tract patency, tolerance for tube placement, and anticipated duration of nutritional support. Explanation: this scenario presents a common challenge in veterinary nutrition, where a technician must select the most appropriate enteral feeding route for a critically ill patient. The challenge lies in balancing the patient's immediate nutritional needs with their physiological status, potential complications, and the long-term prognosis. A thorough understanding of the indications for each feeding tube type and the patient's specific condition is paramount to avoid iatrogenic harm and ensure effective nutritional support, aligning with the VTS nutrition's role in providing expert-level care. The correct approach prioritizes patient safety and efficacy by considering the patient's underlying condition, anticipated duration of nutritional support, and the specific anatomical and physiological limitations of each feeding tube. This aligns with best practices in veterinary medicine, which emphasize evidence-based decision-making and patient-centered care. For VTS nutrition specialists, this involves applying advanced knowledge of gastrointestinal physiology, surgical techniques, and nutritional science to make informed recommendations, thereby upholding the ethical responsibility to provide the highest standard of care. An incorrect approach might involve selecting a feeding tube based solely on ease of placement, without considering the patient's ability to tolerate it or the potential for complications. For instance, placing a nasogastric tube in a patient with severe vomiting or a compromised nasopharyngeal area could lead to tube dislodgement, aspiration, or further discomfort, failing to meet the primary goal of safe and effective nutritional delivery. Another incorrect approach could be recommending a gastrostomy tube for a patient with a guarded prognosis and anticipated short-term need for feeding, leading to an unnecessary invasive procedure and associated risks. These choices would represent a failure to adhere to professional standards of care and potentially violate ethical guidelines regarding patient welfare and resource utilization. Professionals should employ a systematic decision-making process that begins with a comprehensive assessment of the patient's history, physical examination findings, and diagnostic results. This includes evaluating the gastrointestinal tract's functional integrity, the patient's level of consciousness, and the anticipated duration of anorexia or inability to eat. Based on this assessment, the technician should then consider the pros and cons of each available enteral feeding modality, weighing the risks and benefits in the context of the individual patient's needs and prognosis. Consultation with the attending veterinarian is crucial to ensure a collaborative and informed decision. Question 19. When evaluating the nutritional adequacy and safety of a therapeutic diet for a patient with a complex gastrointestinal disorder, which of the following actions best demonstrates adherence to regulatory compliance and professional best practices for a VTS in nutrition? Option A, utilizing a homemade diet formulation provided by an online influencer, assuming it is nutritionally complete because it includes a variety of common ingredients, without consulting peer-reviewed literature or veterinary nutrition resources for validation. Option B, verifying that the diet is manufactured by a reputable company with established quality control protocols and meets AAFCO, Association of American Feed Control Officials, nutritional adequacy statements for the intended life stage and species, or equivalent recognized standards if AAFCO is not applicable. Option C, administering a prescription diet that has been previously used successfully in other patients with similar conditions, without independently reviewing its current nutritional profile or potential for adverse interactions with other medications. Option D, recommending a novel, commercially available dietary supplement that claims to support gut health, based on positive testimonials from online forums, without confirming its ingredient list or regulatory approval. The correct answer is B, verifying that the diet is manufactured by a reputable company with established quality control protocols and meets AAFCO, Association of American Feed Control Officials, nutritional adequacy statements for the intended life stage and species, or equivalent recognized standards if OFCO is not applicable. Explanation. This scenario is professionally challenging because it requires the Certified Veterinary Technician Specialist, VTS, in nutrition to balance the immediate needs of a critically ill patient with the long-term implications of nutritional interventions, all while adhering to strict regulatory guidelines for product safety and efficacy. The VTS must navigate potential conflicts between client expectations, veterinary recommendations, and the available evidence-based nutritional products. Correct approach represents best professional practice because it prioritizes patient safety and well-being by ensuring that any nutritional product used has undergone appropriate safety and quality control measures. This aligns with the overarching regulatory framework that mandates the use of safe and effective products in veterinary medicine. Specifically, it upholds the principle of do no harm by avoiding unproven or potentially contaminated products. This approach also demonstrates a commitment to evidence-based practice, as it relies on established standards for nutritional adequacy and safety. An incorrect approach that involves using a novel, unproven dietary supplement without verifying its safety profile or regulatory compliance would be professionally unacceptable. This failure constitutes a direct violation of regulatory guidelines that require veterinary professionals to use products that are safe and effective. Ethically, it breaches the duty of care owed to the patient by exposing them to potential risks associated with untested substances. Another incorrect approach, such as relying solely on anecdotal evidence or marketing claims for a product's nutritional adequacy, ignores the rigorous scientific and regulatory scrutiny required for veterinary nutritional products. This demonstrates a lack of due diligence and a failure to uphold professional standards, potentially leading to suboptimal patient outcomes or adverse events. The professional reasoning process for similar situations should involve a systematic evaluation of any proposed nutritional intervention. This includes 1. Assessing the patient's specific nutritional needs based on their condition, species, and life stage. 2. Researching available nutritional products, prioritizing those that meet established nutritional adequacy standards and have undergone safety testing. 3. Consulting relevant regulatory guidelines and professional recommendations for the use of specific ingredients or product types. 4. Critically evaluating the scientific evidence supporting the efficacy and safety of any proposed product, particularly for novel or specialized diets. And 5. Communicating transparently with the veterinarian and client about the rationale for the chosen nutritional plan, including any associated risks and benefits. Question 20. Risk assessment procedures indicate that a long-term canine patient, managed by a VTS nutrition specialist, is exhibiting early signs of a vitamin D deficiency. The owner, a devout follower of a specific dietary philosophy, insists on feeding a homemade diet that, despite modifications, consistently lacks adequate vitamin D and calcium, and has an imbalanced calcium to phosphorus ratio. The owner is resistant to supplementing or altering the diet significantly, believing their philosophy is superior and that the dog is thriving. The VTS nutrition specialist has provided extensive evidence-based information on the risks of vitamin D deficiency and the importance of proper mineral ratios for skeletal health and overall well-being. What is the most ethically and professionally sound course of action for the VTS nutrition specialist? Option A. Respect the owner's autonomy completely and allow them to continue with the homemade diet as they see fit, assuming the dog is not exhibiting overt clinical signs of severe deficiency at this moment. Option B. Aggressively confront the owner, emphasizing the severe health consequences and threatening to report them to animal welfare authorities if the diet is not immediately changed to a commercially available balanced formulation. Option C. Continue to educate the owner with evidence-based information. Offer to work collaboratively to find acceptable modifications to the homemade diet that incorporate necessary supplements or nutrient-dense ingredients, and document all discussions and recommendations thoroughly, while consulting with the supervising veterinarian on the severity of the risk and potential next steps if the owner remains uncooperative. Option D. Focus on the financial implications for the clinic and suggest a more expensive, specialized commercial diet that the owner may be more willing to purchase, even if it doesn't fully address the specific deficiencies in their current homemade diet. The correct answer is C. Continue to educate the owner with evidence-based information. Offer to work collaboratively to find acceptable modifications to the homemade diet that incorporate necessary supplements or nutrient-dense ingredients, and document all discussions and recommendations thoroughly, while consulting with the supervising veterinarian on the severity of the risk and potential next steps if the owner remains uncooperative. Explanation. This scenario presents a professional challenge due to the inherent conflict between a veterinarian's recommendation and a client's personal beliefs, particularly when those beliefs could negatively impact the animal's health. The VTS nutrition specialist must navigate this ethical tightrope, prioritizing the animal's well-being while respecting client autonomy to a reasonable extent. The core of the challenge lies in determining the boundary where a client's choices become detrimental to the animal's health, necessitating intervention or a firm stance based on scientific evidence and professional standards. The correct approach represents best professional practice because it prioritizes the animal's welfare, which is the paramount ethical and regulatory obligation of veterinary professionals. It involves clear, evidence-based communication, offering practical solutions, and escalating the concern appropriately when the animal's health is at significant risk. This aligns with the AVMA principles of veterinary medical ethics, which emphasize the veterinarian's duty to the animal patient. Furthermore, it adheres to the VTS nutrition scope of practice, which mandates providing evidence-based nutritional advice and advocating for the animal's needs. An incorrect approach that involves passively accepting the client's decision, despite knowing it poses a significant health risk, constitutes a failure to uphold the duty of care. This could be seen as a violation of professional responsibility and potentially a breach of the Veterinary Practice Act, which generally requires practitioners to act in the best interest of the animal. Another incorrect approach, such as aggressively confronting the client or making ultimatums without exploring all avenues, can damage the client-veterinarian relationship, hindering future care and potentially leading to the client seeking less scrupulous advice elsewhere. This demonstrates a lack of professional communication skills and empathy, which are crucial for effective client education and compliance. A third incorrect approach, focusing solely on the financial implications for the clinic rather than the animal's health, represents a severe ethical lapse and a violation of professional integrity, prioritizing profit over patient welfare. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the nutritional deficiency and its potential impact on the animal's health, gathering all relevant scientific data. Second, engage in open, empathetic, and clear communication with the client, explaining the risks in understandable terms and offering alternative solutions or compromises where feasible. Third, document all communications and recommendations meticulously. Fourth, if the animal's health remains at significant risk despite best efforts, consider consulting with the supervising veterinarian or a veterinary ethicist, and if necessary, explore options for referral. In extreme cases, professional disengagement, always prioritizing the animal's welfare.